Well, we want to go back to the subject of predators who have finally recognized the greatest place to be, the place where they can do their little dirty deeds, the predators, and be hidden and protected, is medicine. Now, I'm going to give you some things, and I've been saying this for years, but now there's so many cases, it's just obvious. Serial killers. What would be the perfect job for a serial killer? Well, hospice. Everybody goes there to die, and you can predict pretty much from their daily records that they have a day left, 24 hours, 48 hours left to live. All the numbers are dropping quick, and they don't have any reserves, and after a while you can predict within hours sometimes when somebody's going to die. Well, this is a perfect place for serial killers. They go to school, they invest 8 years in pre-medicine, they invest medical 4 years, they do the residency, and then they preferentially go and become serial killers in a hospice, or maybe in a hospital, or a senior care center, or the VA hospital, right? And these serial killers kill with impunity. Now, there's a guy who's a nurse practitioner in Detroit. He confessed to killing 40 people in the hospice he was working at over several years, but the investigators who really looked at everything, because he'd been moved around, because the hospital administrators recognized this guy was killing people, so they moved him from one hospital to the next, hoping somebody locally would catch him outside the hospital, killing somebody outside the hospital. And, of course, the investigators said he'd killed several hundred people in the hospice system in Detroit. And then he only got 17 life sentences. Well, if you kill several hundred people, shouldn't that be a death sentence? And then there's pedophiles. What is the perfect job? What is the dream job for a pedophile? Pediatrician? Yes, pediatrician. You never want to leave your little children alone with a pediatrician. Okay? Even the nurse may be in cahoots. So you always want to stay. No, sorry, doctor, I'm going to stay with my child. If you want me to be here with my child, I'm going to take him to a different pediatrician. Kids come with horror stories. Say, oh, now, dear, that can't be right. Dr. So-and-so is such a nice person, right? And then porno. Perpetrators and, of course, distributors of porno. Johns Hopkins, just a couple of weeks ago, actually had to settle with 8,000 women. They settled with 8,000 women for $190 million because a professor of gynecology at Johns Hopkins School of Medicine, very famous, very well-respected School of Medicine, for 25 years, even more recently because they have a lot of modern equipment, he'd been filming pelvic exams and doing funny little things with his fingers to the camera, and he was caught by a female resident who was noticing he kept touching the ink pen hanging around his neck, and he'd touch the ink pen when he'd start the pelvic exam, then he'd touch the ink pen when he'd stop the pelvic exam. Go into another room, he'd do the same thing. And so the female asked him what he was doing. He said, oh, nothing. I just have a habit. And so she reported him, and they investigated. They found out he's been doing this pornography for 25 years. A professor of gynecology at Johns Hopkins, for goodness sakes. And you don't think that all his male colleagues knew what he was doing, probably even being customers of his. And how did they find these 8,000 women to give them, divide up the $190 million? Oh, he put their name on the photographs and the films he was taking as he was doing this stuff. So it was easy to track the 8,000 women who were abused here. I just could think of a better punishment. Actually, he committed suicide as soon as he was outed. They didn't say whether he hung himself or gave himself drugs or shot himself. But I could have thought of a much better punishment, and that would have been to put him in a room or a stadium, like a basketball stadium, lock all the doors, put him in there with these 8,000 women. Oh, I think they could have probably figured out something for a punishment. And then sadomasochists. Sadomasochists, people who get their jollies by inflicting pain on somebody else. Medical doctors. Whoa, there's a place. There's the perfect place for a job. Dentistry, medical doctors of all kinds, particularly surgeons, or anesthesiologists. Oh, what about an anesthesiologist? She's supposed to... How many people say, I was totally restrained by drugs. I couldn't move, but I could feel everything. You hear that so many times. I mean, these are professionals. They're supposed to go to school and know how to track the level of pain, whether the depth of anesthesiology. And I believe that many of these people who make that sort of mistake really aren't mistakes. This is what they do, okay? So, how do we solve the problem? This is the predators are being drawn to the medical system because they're a protected monopoly for 100 years. 2014 marks 100 years that these doctors, medical doctors, MDs, have been a protected monopoly, self-policing, no oversight by any agency. Insurance pays them only. They're giving money to legislatures at the federal, state, county, and city levels these legislators have killed off all the medical doctors' competition, and so the predators have recognized this is the profession I want to go into. Man, this is a dream job for a predator. Well, how do we deal with this? Well, you start taking care of yourself. I want you to get a hold of the book Epigenetics. Get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Learn how to do your own laboratory work. That's right. For $5, you can go in to a pharmacy without a prescription, get all the same test strips your doctor will use for a physical. He'll charge you $2,000 for it. You can do it for $5. You can do your own equivalent of a colonoscopic exam with an occult blood test or a FIT test, which is an acronym for fecal immunochemical test. Cost you $5. You can do all your urine tests, all your blood tests. You don't need a doctor to tell if you have diabetes. Do your own test. Why do you want you have diabetes on your health records? You can do all this yourself. Again, the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. The trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Do your own lab work and deal with over 900 different diseases. Whoa. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about macular degeneration today, as I have
one of my favorites, actually.
I got a Fox News story here that's headlined, Smoking Linked to Risk Progression of Macular Degeneration. They say people who smoke or have smoked a large number of cigarettes over time are more likely to develop age-related macular degeneration or have it worsen sooner, according to this long-term study. And the study that they're referring to is the Beaver Dam Eye Study. This was a study done in the city of Beaver Dam, Wisconsin. Almost 5,000 people, started in 1988, and they examined people's eyes at the beginning of the study and then followed up every 5 years or so. And what they found was that those that had smoked had a greater risk of getting macular degeneration earlier in life, and of course age-related macular degeneration, or AMD, is a common eye disease that results in the damage of the central part of the retina, and it is the leading cause of blindness among Americans over the age of 50. And for the interview, they talked to Dr. Neil Bressler. I believe he's ABC's health expert. He's also an ophthalmologist at Johns Hopkins University School of Medicine in Baltimore. Was not involved in the study, but he explained that macular degeneration leads to a scarring or atrophy of the center of the retina, the macula, and is responsible for fine vision needed for reading, driving, and recognizing faces. The current theory that smoking might damage the blood vessels that nourish the retina. And for this study, a person that did the study at the University of Wisconsin School of Medicine, Chelsea Myers, she's a researcher in the Department of Ophthalmology and Visual Sciences, and her and her colleagues, they looked at almost 5,000 people starting in 1988 and followed them up every 5 years. A total of 4,439 participants went through the whole study. And they found that 24% developed early-stage AMD over the course of 20 years, and 4.5% progressed to a late-stage AMD. And they say current smoking was tied to a 36% greater risk of progressing from minimal to moderate AMD, and people who smoked the most cigarettes over time had a slightly increased risk of developing minimal early AMD and going from severe early AMD to late-stage AMD. And, of course, they say this doesn't prove that smoking causes AMD, because we know the cause of AMD, and you can explain that.
Exactly. Well, to make a long story short, we actually have a CD out, Doug, called Seeing is Believing. It talks about a wager I had with an eye doctor from Salt Lake City, and I said that I could actually reverse macular degeneration, and he stood up in the back room and said, "Wallach, you're a liar." And I said, "Who are you?" He said, "He's an eye doctor." And that you couldn't. This was an aging thing. You couldn't prevent it, and you certainly can't reverse it. And so, to make a long story short, I wagered him that if he gave me 12 of his people who were legally blind for 6, 8, 10 years, if I could get half of the 12, 6 of them to see 20/20 in 90 days, would he apologize if he could get 2? So the next day he brought me a box of 27 charts for the people who had all been blind at least minimum of 6, 7, 8 years with macular degeneration. And I said, I'll take all 27 of them. He paid for the supplements. We gave him a supplement program with all 90 essential nutrients, and some of these supplements actually increase blood flow through the blocked arteries, antioxidants, and all of them, 90 days, all of them could read 20/20, only 2 required glasses. 25 to 27 could read 20/20 without even glasses. So he did apologize. He kept his word, and he made me the CD. It's him apologizing to me and telling the story, and just he's flabbergasted, of course, on the CD that we're able to do this. We've been doing it thousands and thousands of times a year since then. This goes back, it got to be 6-8 years ago, and everybody loves that CD. Seeing is believing. Contact your Youngevity associate and ask for seeing is believing. It's not true that you can't do something about it. We've reversed it. We continue to reverse it. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
All right, let's head to New Orleans, Louisiana. And Charlie, you're on with Dr. Wallach.
Charlie, you're on the air. Hello, Charlie. Going once, going twice?
Yes.
Okay. Don't put us on hold, Charlie. Okay, what can we do for you?
I was calling about your 90 essential vitamins. I have a heart problem.
What kind of heart problem?
What
kind of heart problem?
I have coronary artery heart disease. I have three stents in my heart, and I'm taking Cor-Ray for the heart, and I'm taking Isobed for the angina pains. I was calling to find out would these 90 essential vitamins do anything for that.
Okay, what you want to do, obviously, you're going to have to stay on your drugs for a while. You let your cardiologist take you off those drugs, probably wean you off of them. What do you weigh, Charlie?
I weigh 177 pounds.
Okay, now, the reason why we get in trouble, the reason why we have our coronary arteries plugged, which creates angina or chest pain, and the requirement for stents, and actually there's no requirement, but doctors tell there's a requirement for stents and bypasses, is that you have to change everything you're doing, because it's what you were doing got you in trouble. You have to give up fried foods, nothing fried, no exceptions, no fried foods. Then you have to give up all the saturated, you have to give up all the processed meats. There's where I'm going to processed meats with nitrates and nitrites. All the processed meats with nitrates and nitrites. These processed meats are ones like deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam, canned meats, hot dogs, all that's got to go. And then absolutely no oils. There's no olive oil, no coconut oil, no margarine, mayonnaise, salad dressing, cooking oils. If you eat canned fish, they'll be packed in water, tomato sauce, and mustard. Absolutely no oils. And then no gluten, no wheat, barley, rye, oats. And you can get all that on the CD called Serial Killers. And then I want you to take it, 177 pounds. What would you do for a guy who has coronary artery disease, Shar?
I'd give him Ultima Daily.
Okay. And what would you give him as the basic program?
With a healthy heart and brain pack. 2 of them.
Okay.
He needs 2 of them.
Yeah, he needs 2 healthy brain and heart packs, exactly. 2 healthy brain and heart packs. I would go ahead and take a full dose of everything at breakfast and dinner. That would be 3 of the selenium at breakfast and dinner, an ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner, and then, as Shar said, I'd have you get a bottle of the Ultimate Daily tablets. Take 3 of those at breakfast, 3 at dinner, and that's going to support and promote healthy blood flows for obstructed arteries. And also, I would throw in one more thing, the HGH. Take 6 HGH at bedtime with a glass of water, and call us every 2 weeks, Charlie. You're going to be a new man. We'll be back with Dead Doctors Don't Lie for these messages.
Let's head to California. And Tamoyo, you're on with Dr. Wallach.
Tamoyo, you're on the air.
Good afternoon, Dr. Walsh.
Yes, how can I help you?
Yes, I have a sister in Christ that she's very ill. And I recommended her to take this supplement, and she's still feeling ill. And she's taking the Star Pack with the glucogel. And I see her in church on Sundays, and she still looks like
okay, now, stop there a minute. Is she having bone and joint problems?
She has very
high blood pressure? I didn't get what her problem was.
Her problem is arthritis. Arthritis, I don't know what.
Okay, and what does she weigh? What does she weigh?
She probably weighs like 100 pounds.
Okay, very small person, 100 pounds. Okay, yes. Well, here's what I would do for her. First of all, she should not stop her medication she was taking for pain immediately. do not let her stop any medication, especially narcotics, things like morphine, that sort of thing, because people can get withdrawal symptoms. They're going to feel very, very bad. So people should not stop pain medication immediately when they start taking the program. At 100 pounds, she should, from our side, she should take, first of all, well, I'm going to let Char answer because you're about 100 pounds, Char. What's to somebody that has arthritis? What would you do for them dietary-wise, and what would you do for them from a supplement program?
Well, I would get her on a gluten-free diet just in case, because most Americans have a gluten problem.
Mm-hmm.
And then I would get her on the healthy bone and joint pack, definitely.
Okay. And would you give her anything extra? You know, one healthy bone and joint pack, would you give her anything extra in addition to that?
Well, I don't know.
Yeah, it wouldn't hurt to give her an extra bottle of osteo so she could take 2 ounces a day. Or if she has disc problems or she has bone-to-bone arthritis, wouldn't hurt to give her an extra bottle of osteo, not osteo, but the glucogel, so she could take 15 a day instead of 10 kind of thing. Kind of do that. But you're exactly right. I would give her the healthy bone and joint pack, and I'd get her on a gluten-free diet, and I'd get her an extra bottle of the osteo so she could take an ounce at breakfast, ounce at dinner, and I'd get her an extra a bottle of glucogel so she could take 15 a day, 5 at breakfast, lunch, and dinner. But it could be imperative, Tomoyo, that she stays on her pain relievers, and after about a month on the program, she can try reducing the pain relievers just a little bit, maybe 10% or 25%, and see how that works for her. Or if she wants to, if she's a little nervous about doing that, she could ask her doctor, hey, I'm feeling pretty good. Can you show me how to reduce my medication a little bit? But when you're on particularly narcotic-type pain relievers, do not cold turkey off of them because you will go through withdrawal symptoms. If you're taking cortisone, prednisone, although they're not narcotics, if you've been on cortisone or prednisone for years and years and years, and you cold turkey off of that, you're going to feel very, very bad. And so you don't want to put yourself in that position. You want to take time and allow the nutrition to do its job, and then you slowly wean off of these medications. In some cases, particularly narcotics, I would have your doctor help you do that. Okay, we'll be back after these messages.
Let's head to Virginia. And Jessica, you're on with Dr. Wallach.
Oh, Jessica, you're on the air.
Yes, Dr. Wallach. I was calling in reference for a friend of mine. She's been diagnosed with CPD, and the doctor said...
Whoa. Tell me what she's diagnosed with.
CPD.
What's DPD?
C is in cat.
Okay, what is CPD?
It's one of those diseases that she can't breathe. She have like...
Okay, now wait a minute. Is it COPD?
COPD, you got it.
Well, we left out a word there. Okay. I know what COPD is.
Yes.
Okay, so go on.
And she was diagnosed with that, and the doctor said asthma has also set in, and I was calling to see if there was some product.
Yeah, how old is she?
She's 80.
Okay. And does she have any other issues, high blood pressure, diabetes? Does she have arthritis?
She's taken a blood thinner, I know that.
Okay, did she have a stroke ever, do you know?
I'm not aware that she had a stroke. I just know she...
Wait a minute, anything like atrial fibrillation?
No.
Okay.
I'm not aware of that.
Okay, so asthma, COPD, 80 years old. I'd be amazed if she didn't have some other issue. Do you know if she has any skin problems?
I haven't seen any on her.
Okay. Do you know if she has any children?
Yes, she does.
And do you know if they have any illnesses?
I'm not aware if they do.
Okay. How much does this lady weigh, you think?
I would say about 115 pounds.
115, okay?
Yes.
All right. Char, this is a Char thing. Here's a 80-year-old lady, 115 pounds, has COPD, chronic obstructive pulmonary disease, and developing asthma. What would you think?
Well, she definitely needs to get on a gluten-free diet because asthma is a gluten problem.
Mm-hmm.
And then she needs to get on a healthy start pack.
Okay.
But asthma, she needs what, selenium and...
No, well, she could have that, but basically, what would you do? What would you do for circulation?
I'd give her the Ultimate Daily, and she needs the EFA for the asthma too.
Yeah.
Well, that's
okay.
part of the healthy start pack.
Mm-hmm. There you go. So the Healthy Start Pack for, one for 100 pounds of body weight, 115 pounds. So I'd give her the one Healthy Start Pack. And I would also throw in the Ultimate Daily tablets, as you said. Perfect. And I would give her a tablespoon, which is a half ounce of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, the 3 EFA Pluses, I divide them up, 1 at breakfast, 1 at lunch, 1 at dinner, or 1 at breakfast and 2 at dinner. And then the Ultimate Daily tablets, 3 at breakfast, 3 at dinner. That's 1 bottle a month. And that's going to help get the blood flowing through the lungs, which is going to help COPD, which you have chronic scar tissue in the lungs. And Jessica, what you might want to do is check with her and see if any of her children have any of these problems, because they need to get this information, because gluten intolerance is passed on through the cord blood and breast milk. So if she has any children or siblings, her brothers and sisters, and her sister's kids, and her daughter's kids all have to get on a gluten-free diet, take the 90 essential nutrients. But even at 80 years old, I had dinner last night with an 87-year-old lady, and she's been really good about avoiding all the bad stuff. She's been on our program for a couple of years, and she looks like she's 40 years old. She's 86. She's 3 years from being 90 years old, and she fools everybody all the time. She has the energy, brightness, has no memory problems. She is hot stuff at 87 years old. And so, Shar, you and she would be good friends, because, Shar, you're 71 and you look like you're 40. And so I can't, and you've been taking the products for how long?
Oh, 25 years.
I mean, how good is that? Okay, Doug, let's go to callers.
All right, let's head to Capitola, California. And Kat, you're on with Dr. Wallach.
Is that Kat?
Hi, Dr. Wallach. Thanks for all you
Kat,
do.
what's up? Mm-hmm.
I'm a long-time associate. I'm helping a dear friend get started on a program. She's 90 to 95-pound lady, trouble keeping up her weight, lots of migraines, allergies to nuts, dairy, and many foods, shaky hands, low back pain, and her lips are extremely painful and sensitive, not chapped. She said just for weeks now, sensitive to the touch and hurt. Lots of stress. So I'm wondering, I'm suspecting gluten intolerance, but I want to know what to advise her, thinking the Digestive Healthy Pack. Well, what do you think?
Okay, how much does she weigh?
90. She's between 90 and 95 pounds.
95 pounds, and she's 95 years old?
No, she's 47.
Oh, 47.
Yeah.
Okay, 47 years old and 95 pounds. Okay, there's a disease called trigeminal neuralgia. And trigeminal neuralgia is a squeezing of the fifth cranial nerve as it comes out from behind the ear, goes across the face, above the the roots of the upper teeth, and below the roots of the lower teeth in your jaw. And if you even walk close to the people with this, it feels like somebody's sticking them in the face with an ice pick. It's very tender, very painful. It's called trigeminal neuralgia. So I suspect that's what she's got, especially if it's on both sides, trigeminal neuralgia. Does she ever complain about ringing in the ears or buzzing or dizziness or anything like that?
Dizziness and fainting, faint light, yes.
Okay, now dizziness, that could be caused by ataxia, okay, which used to be called Meniere's disease, has been renamed Wallach's vertigo after me. Finally got one. And that would be very common, because that would go along with the painful lips. That's a squeezing of the eighth cranial nerve, and that would go along with called tinnitus for the ringing in the ears, dizziness. Again, it's called Wallach's vertigo. It used to be called Meniere's disease. And this is a squeezing of both the vestibular and the auditory branches of the eighth cranial nerve. And at 47 years old, back pain, you said she has back pain, correct?
She got whiplash in a car accident.
Oh, car accident, okay. So, Char, what would you do for a 95-pound lady, has back pain, she's got osteoporosis of the skull because she's got, I believe, trigeminal neuralgia. She's also got maybe Wallach's vertigo, certainly tinnitus. What would you give her?
I would give her the Healthy Bone and Joint Pack and then give her some extra glucogel.
Absolutely, perfect. And what would you do with the CM cream?
Rub it on the spots that hurt. And rub it in,
okay.
Good. And put it in her ear, too.
There you go. Stick it in her ear, right? It would take a quarter of a teaspoon. A little lady like that, I would take a quarter of a teaspoon of the CM cream, which comes with the Healthy Bone and Joint Pack, and take a Q-tip and let herself put it down in each ear like she's trying to get wax out of her ear, and that will reduce the inflammation around the roots of the fifth cranial nerve, relieving that trigeminal neuralgia. It will also cause a reduction in the inflammation around the roots of the 8th cranial nerve and relieve this dizziness if that's what's causing it. Just in case, this is a whiplash problem from this accident, I would definitely give her some glucogel. Get her at least 1 bottle of glucogel, so you have a minimum of 10 of those glucogel capsules a day, 5 at breakfast, 5 at dinner. And call us every couple of weeks, Kat. Let us know how she's doing. And if you find anything more out about her, but this is a good place to start. Get her off all the gluten, fried foods, processed meats, and oils. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Online, the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 90 for Life Crusade. And Doug, let's go to callers.
Now let's head to Wisconsin. And Gerald, you're on with Dr. Wallach.
Gerald, you're on the air.
Oh, hello, Dr. Wallach, sir.
Yes, sir. How can we help you?
I'm going to try to cover this quickly, autoimmune retinopathy, peeling of the retinas, whatever they want to call it. My vision is rapidly going downhill. This has been going on since 2002. Contrast issues. I can read a book, but
okay,
I have a white object.
No. All I need to know is, has your doctor attempted to treat you?
They have. I've been on high-dose steroids because I've also had MS symptoms. The spinal tap came back clear. The high-dose steroids
test came back negative, but you have symptoms.
Correct.
And by symptoms, we got to go quickly here because we only have a moment. By symptoms, you're talking about blurred vision, slurred speech, motor problems. What are you talking about, symptoms of MS?
Pin poking, loss of feeling in different parts of my bodies. And
okay, so you have so you have analgesia here and there. Okay. What do you weigh, sir?
171.
Okay, Shar, what would you do for this fella?
First of all, he needs to get on a gluten-free diet, but he needs 2 healthy brain and heart packs.
Perfect.
And he also needs to eat lots of eggs and everything.
Yep, especially with the MS symptoms. You're exactly right. 171 pounds, I'd have him eat 6-8 eggs a day, either poached with soft yolks, soft boiled with soft yolks, soft scrambled in butter, not margarine or oils. No oils whatsoever. No oils. We're talking about absolutely no coconut oil, no olive oil, no margarine, mayonnaise, salad dressing, cooking oils, no gluten, as Shar said. That's no gluten, no wheat, barley, rye, and oats. And I want you to take 3 Vision FX also, 3 at breakfast, 3 at dinner, 2 healthy brain and heart packs per month, as Shar said. And it would also get your auric points above 100,000 a day by taking 5 of the Cell Shield RTQ capsules, 5 of those twice a day. And lastly, I would have you take the immortalium to encourage stem cells to actually help promote and repair the retina by generating more stem cells so they can help rebuild things. Okay, immortalium, I'd go ahead and take 3 twice a day. It'll be 2 bottles a month of the immortalium. This is going to take some work, but it's doable. And retinopathy could be macular degeneration depending on random location. You could have MS symptoms and not have lesions that are observable by a CAT scan or an MRI because and I would like to see what the radiologist said about these scans of the brain. So if you ever have a chance to get a hold of that, I'd like to have you read the summary to us. Okay, call us every couple of weeks. Let us know how you're doing, Gerald. How much time we have here, Doug?
Just about 60 seconds.
60 seconds. Okay, Shar, you have 30 seconds to tell us how people can avoid the predators in medicine.
She appears to be gone.
Okay, well, I'll tell you. Take care of yourself. Get a hold of that trilogy of books. Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Learn how to do your own lab work. Learn how to deal with over 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Get a hold of the books Epigenetics, Immortality, and also Rare Earths and Cures, and learn how to add 25 to 50 healthy years to your life. This is not difficult. You can do this. If you can read the 5th grade reading level, you can add many, many healthy years to your life, better yet, to your kids' lives, and avoid the predators. You do not want to go to the medical system just because you have insurance. Do not go there. According to the statistics, medical doctors in America each year kill, injure, and infect 15 million of their customers every year in the workplace. Each year in America, medical doctors kill, injure, and infect 15 million patients in hospitals and clinics. Why would anybody want to go there when you can do these things yourself? We want you to think of Youngevity as the Home Depot and the Pep Boys of America. Well, thank you so much, Shar. Thank you so much, Doug and RJ. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.